Lucio, welcome to our YouTube channel today. I practice integrative medicine and pain management in Jefferson City, Missouri, and this is my wife.
Hi, I'm Dr. Jennifer Sue. We upload one video a week about an integrative approach to different medical topics. We've been wanting to do this subject for a while, and it's about bioidentical hormone treatment. I'd like to cover the 5 tips about bioidentical hormone treatment, and you wanted to cover...
Yeah, just a small summary. You know, most women undergo menopause at some point in their life, and some of these symptoms can be very bothersome for them, and they're usually the result of increased blood flow that usually affects the face, the neck, and the chest, and women experience these night sweats. It also affects their sleep, which then affects the rest of their health. Other symptoms that they get include anxiety and heart palpitations. Now, the symptoms last 1 to 2 years, but they can last up to about 14 years, and some of the things that make women predisposed to it include obesity, tobacco use. Some ethnic groups also have more prone to it, such as African Americans. Asian women seem to have the least. There are also some other symptoms that occur as well that are not considered due to circulation or what we refer to as non-vasomotor symptoms, and they include increased risk for heart disease, so it's extremely important that this gets addressed, increased risk for urinary tract infections, increased weight, decreased bone loss.
Menopausal symptoms can actually start even at age 25. The most common age range that he's talking about with these symptoms is between the ages of 45 and 54. The 5 tips that we'd like you to know about bioidentical hormone treatment is number 1, what is the difference between natural hormones and bioidentical hormones? Number 2, are they safe? Number 3, do I need them? Number 4, what if it quit working? What do I do? And number 5, what are the alternatives that I can use besides bioidentical hormone therapy, or some things that I can add to my treatment that my doctor's given me? Number 1, the term bioidentical hormone therapy seems to be synonymous with the word natural, but actually they're 2 different things. Natural would be something that's not man-made and not made synthetically in a lab. Bioidentical hormones are actually made in a lab, and they're synthetic. Natural hormones are actually made from horse's urine, and that's how they got the word Premarin, which is a brand name for estrogen. Premarin is the natural one, but if you're looking for hormones that are more identical to what our body makes, then you're getting into bioidentical hormones. These can actually be made by a pharmaceutical company, or they can be made by a compounding pharmacy. Estrogen that is bioidentical are actually E2, which is estradiol, and E3, which is estriol. Both men and women make 3 types of estrogen, just to summarize. E1 is called estrone, and that's just a very bad player. This estrogen, E1, causes more incidences of breast cancer and uterine cancer in women. E2 is estradiol. It's easier to remember because diol is D-I, diol 2. That is a great estrogen, very useful, very powerful. And E3 estriol, which 3 estriol, that actually helps E2 to work. Whenever you're talking about bioidentical hormones, they will be called estradiol or estriol, and they come, as I said, either in a pharmaceutical company or from a compounding pharmacy. Bioidentical hormones can also be made into different forms like oral troches, TROCHEs, or they can be administered through the skin transdermally or subcutaneously with pelleting, transdermally with creams.
There's a lot of information there. So how do you pick between, when someone says, how do you know which I guess I'm a little even confused about the bioidentical versus regular.
Bioidenticals are always synthetic. That's a really good question. Bioidentical hormone therapy is always going to be synthetic. The only natural ones are Premarin, which are made out of horse urine. They're in certain doses as a tablet. Now that you know the difference between natural and bioidentical hormones, when you go to your doctor, you may want to ask, are these safe? Are bioidentical hormones and also natural hormones safe? And the answer is yes, but I'm going to take you through a timeline I've been in practice 20 years. Back in the 1960s, hormones were touted to be wonderful. Every woman was on them because there are many, many benefits with much evidence backing them up. They help to prevent heart disease. They help vasomotor symptoms, like he said, with hot flashes. They help vaginal symptoms and prevention of urinary tract infections. They helped with skin health, making you look dewy. They helped with memory and cognition and so many benefits, as well as bone health to prevent osteoporosis, because none of us die from a hip fracture. We die because we have the hip fracture first and then we have sequela after that. Then fast forward to 2002, the Women's Health Initiative study was a $1 billion study. I'm getting all of this information from a great book called Estrogen Matters by Dr. Avrum Bluming. If you haven't read it, I would really suggest reading it. What they decided back in 2002 from the Women's Health Initiative study was they stopped the study after 5 years because they found an increased risk of breast cancer. So 70% of all patients went off of their hormone replacement in 2002. I think all of us remember that scare. I included took all of our patients off. At that point, women started having terrible hot flashes, terrible vaginal dryness, pain with intercourse. What ended up happening was the American College of Obstetrics and Gynecology started recommending that if women needed it, that we would counsel them that the Women's Health Initiative study findings were this, but if they needed it, then the benefits outweighed the risks, and that we would give them hormone replacement only in the lowest dose for the shortest amount of time needed. There's plenty of new data showing the opposite is true. Estrogen is really safe, and it's actually beneficial for prolonging women's lives, for decreasing breast cancer in breast cancer survivors, and prevention of fractures from osteoporosis and prevention of heart disease in women. Looking back at the Women's Health Initiative study, this was a poorly designed trial. There was no statistical significance. The p-value was 1. They pushed this data through to the media, and it scared all of us, practitioners included, and it still affects us to this day. If I see a patient who needs estrogen because I feel it is beneficial, I do actually talk to their primary doctors and their oncologist if they've had a history of breast cancer. The current data shows that there is not an increased risk of breast cancer, and this includes both the transdermal, pelleting, oral troches, and the oral hormone replacement. So this is very important for you guys to know. So the summary is that it is safe. One caveat is that it's safe in terms of breast cancer. But if you're a woman who's had a history of any kind of heart condition, heart attack, then you are not allowed to have hormone replacement therapy. So just remember. How will we know if we need it? So if you went to your doctor's office, how would you know? Should you be on it if you're not having any of the symptoms that Dr. Lucio talked about? Some of them are very straightforward. Like if I have vaginal dryness with intercourse, it's going to feel like knives as my husband's trying to have intercourse with me. I may have a dry vagina even walking where it feels like sandpaper. Or brain fog. You're an executive at a meeting and you're always in charge, and it's embarrassing when you can't think of the right words to say. Estrogen is very important to help us with brain sharpness and function. Those are straightforward. On the other hand, let's say you're a woman who doesn't have any menopausal symptoms. Should you be on it? And the answer is yes, because you want to prevent heart disease. You want to prevent bone fractures from osteoporosis. You want to help your brain to function. I think we've done a disservice to women for these past, 2002 minus 2, so the past 17 years, all because of a very bad study. If you read the book Estrogen Matters, Dr. Bluming talks about how this is how we get in trouble with studies that are poorly designed. Of all these women that they chose to do this study were all over age 60 with multiple medical problems already. 4. What if you're on a bioidentical hormone treatment and it's working great, you're loving life, your brain's working, no hot flash, you're sleeping really good, all of a sudden it quits working, or your doctor prescribed it to you and it's just not working? Well, it's very important that your doctor measures levels of your hormones. The reason that we use saliva testing or urine as a preferable way of measuring hormones is that it gives us the true picture of what hormones are still free and available to be used, because Once your receptors are all used up with all your estrogen and progesterone and testosterone, all that's left floating around will be excreted in your urine and your saliva. So when you measure those levels, then you know if you have enough to help with the symptoms that you're having. So if you're really not getting any help anymore, or it really didn't work to begin with, don't just increase the dose. You really need to measure your levels. And then next, find out, is it a certified compounding pharmacy? They should be certified by the compounding pharmacy people. This is not a regular pharmacy standard, because the mixes of the cream should have hormone throughout the entire mix of the cream. It shouldn't be all settled at the bottom of the machine, so that if you get your hormone, you don't have the actual dose that you were supposed to have. Second is, are you applying it correctly? Because sometimes we keep applying it to the same place every single day, and what happens is the fat on that area, like I'll have our patients apply it to their inner thigh, it just gets stored there because the fat can only absorb so much hormone, and then if you keep piling more and more hormone on, it kind of just sits there as a reservoir and it never gets used. So alternate the sites. So you always want to change the sites every day. Third thing you want to check if it's not working is you want to address your other health issues. Is your thyroid working correctly? Do you have diabetes? Do you have stress that you need to manage? And you also want to see if you have adrenal fatigue syndrome, which is reversible. That will affect your ability for your hormone treatment to work or not. The fifth thing that we'd like you to know about bioidentical hormone therapy is that if you are using bioidentical hormone therapy and find that it doesn't work, what are some other alternatives or maybe complementary things that you can add to your treatment? Many things. If your hot flash starts here and goes up, that's a stress activated hot flash. So if a hot flash starts in your chest and goes up the front of your neck, that's usually from stress. If you just get hot all over, that's just a normal hot flash. So if you're getting lots of stress hot flashes coming up from your chest, try to manage it with stress management techniques. We love teaching the 4-7-8 breath. You can show them that in a little bit. The 4-7-8 breath is great. You teach them meditation, autogenics training. There's so many things on YouTube. Yoga. There are also acupuncturists, and once they place all the needles, oftentimes you fall asleep. That's that relaxing. But that's all to help management of cortisol levels so that your hormone replacement can work better. The other alternatives that you can use if you don't do bioidentical hormones or hormone replacement at all, I love chaseberry. Chaseberry is great. And chaseberry you just take every single day. It takes about 2 to 3 months for it to work, but it's used for 300 years. How it works is it helps you make your own progesterone levels better. So there's no added hormones. There's commercially supplements. One's called Brisdell, Relazin, vitamin E, soy, black cohosh, menopal. These are all over-the-counter remedies.
4-7-8 breath is one of many techniques or many breathing techniques that they put under the umbrella breathworks. 7-8 really is a very simple technique.
And you do that repeatedly 4 times per cycle, and then you can only do it twice a day. The effects get more and more strong as you do them. It looks like this as doing 4 in a row. And it's true, the relaxation that comes about, the effect does get stronger and stronger. And so this is excellent if you have a very stressful job and you think that those hot flashes come from stress. And do it just like a prescription, do it twice a day like you said.
Thank you all for joining us today. Have a happy Easter. And next week we're going to be talking about integrative approaches for fibromyalgia.
See you again in our next video.
Bye-bye.